everyone. My name is Kelly Baldwin, and I am the GME Wellness Officer. And today, Dr. Katie Sharp and I are going to be presenting Just Ask Me, which is a 5-minute video on symptoms of burnout and depression, specifically targeted for our residents and fellows. The first symptom we're going to take a look at is emotional exhaustion. Watch this video of one of our off-service residents.
I don't know how I'm going to be on call tonight.
Wow, what just happened there? It was pretty subtle, right? The resident says, I just don't think I can do this anymore. And right there is your symptom of emotional exhaustion. The title of this talk is Just Ask, right? You're sitting in that workroom and you hear those comments. That is emotional exhaustion. And the first step is to turn around and say, hey, are you okay? What's going on? Let's talk about it. Let's take a look at the second symptom, which can be detachment, cynicism, and loss of empathy for your patients.
Yeah, neuro? Yeah. Why? Okay. Did you examine them? Great. Okay, yeah. No, I'd rather not talk to the family if I could avoid it. So do you just want Rex, or do you need us to come down there and examine them for you? Okay, got it. Thanks. Bye.
Wow. I would not want to be the emergency medicine resident on the other end of that call. You can see that the neurology consultant is burned out, right? He's lost his love for neurology. He doesn't want to go talk to that patient's family. He's detached and cynical. These are symptoms of burnout. And I think it's easy for residents and fellows to look the other way and say, oh yeah, we're busy. That's okay, but it's not okay. This resident's struggling. Just ask. Ask, are you okay? I notice your behavior is different. I notice you're not really excited today and wanting to see patients. Let's go get a coffee. Let's go talk about it. What's wrong? Sometimes this can manifest as just wanting to vent to get through your day. And that should clue you in that you could be burned out. Let's take a look at the next video. This symptom is feeling useless, not good enough.
Hey, you okay?
I don't know, Cliff. Just so overwhelmed with everything. I'm not able to do this job. And they shouldn't have even let me in residency. Just so overwhelmed and so emotional about everything. Just can't do it anymore, man.
Whew, this one wasn't as subtle, was it? This is what we call lack of efficacy. A little voice in your head telling you, you're horrible, you're not good enough. You heard that resident say, why did they even let me in to this residency? These symptoms are really serious. They can lead to clinical depression. They can lead to resident and fellow suicide. And they lead to residents quitting medicine. These are all serious symptoms of burnout. Turn around, just like the resident sitting next to her did, and say, are you okay? What's going on? So residents and fellows, what can you do when you're in the workroom or on the wards or in the clinic and you hear these comments from your fellow residents? Step one, just ask. Say, what's going on? Are you okay? Let's take a minute. Let's go talk. Don't ignore the commentary. Don't ignore the symptoms. That will fuel the burnout epidemic. Step two, intervene. After you say, are you okay? Let's go talk to someone. I think this is serious. Let's go talk to the chief resident, the program director, the APD. Dr. Baldwin, let's call her. Let's see what we can do to help you. Step 3, what we'll do on our end as the leaders is we will get you help. We will get you the resources that you need to combat burnout, to be sure that you're healthy and safe and performing at your very best. There's some examples here in this slide of what could be happening for you to think about. Many times, it's a system problem. You're working too many hours. You have work compression, patient after patient after patient, not enough sleep. In this case, the system needs changed. Your program may need to make adjustments in your work hours or the amount of residents that you have. And this is where the program director involvement is critical. Example 2, it could be a stressful event that provokes the burnout symptoms. A bad patient outcome is one of these. This may benefit from critical incident stress debriefing, which is a service we have at Maine Med. You just pick up the phone and you page spiritual care 24/7. They can come and debrief you and debrief your team and have a safe place to talk about your emotions. Example 3, maybe it's a fusion of personal stress at home, financial stress at home, and a difficult work environment. And I think this is most common. For this, we may refer you to the peer support program. Maybe you need a mentor that is a peer that's been there, that's been through this, and can help you navigate the system and your feelings. And then finally, this could be an underlying serious mental health disorder. If your symptoms aren't going away when you're on vacation or when you're out of the hospital, you might need to see Dr. Price in psychiatry. You may need medication management, or you may need counseling, and we could refer you to the employee assistance program. There is help for you to combat burnout, to combat these symptoms, to prevent depression and suicide, and to treat it when needed. So please, residents, fellows, your job, just ask. Here are the resource lists that I mentioned. If you can't remember what I said, everything's listed on the Maine Health Graduate Medical Education Wellness website. Check it out. Thank you, and this was the Justin 5 on Just Ask.